You know, in every pregnancy, there comes a moment when you ask yourself one single question, a question that can completely change the path of the most important journey of your life. Today, we're talking about the answer to that question that's a part of millions of birth stories all over the world, the cesarean section. We're going to find out together when it's necessary, how to prepare for it, and most importantly, how to recover. For so many expecting parents, this is it. This is the big question that takes up so much space in your mind throughout the pregnancy. It really feels like a fork in the road, one that will shape one of the most powerful moments of your life. So let's really get into it.
The whole point here is to walk through this together, to explore the medical reasons, and to really understand the why behind this decision, so you can feel empowered and informed. We're going to look at the signs and the situations where a C-section isn't just an option, it's actually the safest choice for you and your baby.
A lot of the time, the decision to have a C-section isn't random at all. It's actually a response to some really clear signals that the pregnancy itself is sending. So let's take a look at some of these signs your body sends you. Okay, now this is really interesting because it shows just how important this one factor is. The ideal position for a natural birth is head down, ready to enter the birth canal. But if the baby is in a breech position, that means feet first, or transverse, which is sideways, a C-section is often the absolute safest way to deliver. So what about size? Well, if ultrasound estimates show that the baby is quite large, we're talking around 4 kilograms or more, a doctor might recommend a C-section. This is to avoid what's called a difficult birth, which can pose risks to both the baby and the mom. This is such a critical point. The placenta is the baby's lifeline, right? It's what provides oxygen and nutrients. In a condition called placenta previa, the placenta is actually blocking the exit. So, during a natural delivery, the placenta would detach before the baby is born, cutting off that vital supply line. That's why if this condition is still present at the due date, a C-section becomes an absolute necessity for a safe delivery. So, beyond the baby's position and size, there are other clear-cut medical situations where a C-section isn't just an option, it's a must. Let's explore those now. Yeah, there are several other factors that can come into the equation. If the umbilical cord slips down before the baby, it can get compressed, and that's an emergency. Carrying twins or more can create complex issues with their positioning, and sometimes it's the mother's own health, like a serious heart condition or severe preeclampsia, that makes the stress of natural labor just too dangerous. So here's the bottom line. Every single one of these medical reasons points to one crystal clear goal, and that is the health and safety of both mom and baby. It's all about choosing the path that ensures the best possible outcome. And this leads us to a really important question. We've established that it's a safe and necessary procedure in so many cases. So where does all the anxiety come from? Let's face that feeling head on. All right, it's time to separate the medical facts from the common fears that can sometimes cloud the conversation around C-sections. And this slide puts the core truth so well. When there's a clear medical reason, a C-section is an incredibly safe and common procedure. The reason natural birth is preferred when possible is simply because a C-section is still major abdominal surgery, and it requires a longer recovery time. But in terms of safety when it's needed, it has an excellent track record. Now, let's shift gears and talk about what happens after the surgery, because understanding the path to recovery is one of the best ways to feel prepared and in control. The journey back to feeling like your full self isn't about giant leaps. It's about taking small, steady, and really important steps every single day. These are the 4 pillars of a good recovery. First, movement. Walking as soon as you're able is vital to prevent blood clots. Second, hydration is key for healing. Third, simple wound care, just keeping it clean and dry prevents infection. And fourth, listen to your body. Rest isn't a luxury, it's a critical part of the healing process. This last section might just be the most important one of all. Knowing when something isn't right and when to get help immediately is absolutely crucial for your safety. Let's start with the signs that mean you need to pick up the phone and call your doctor's office for advice. These aren't necessarily go to the ER emergencies, but they do need a professional opinion. So pay close attention to these. Unusually severe uterine cramps, a headache that just won't go away, difficulty urinating, or any signs of postpartum depression or anxiety. Your medical team is there to help you through these things. Okay, now we're going to raise the alert level. The following signs are different. They are not a wait-and-see situation. If you experience any of these, you need to head to the emergency room right away. And these are the ultimate red flags: heavy bleeding, any signs of infection at the incision site like pus or blood, sudden difficulty breathing, sharp pain in your leg that could indicate a clot, or any thoughts of harming yourself or your baby. These are true medical emergencies that need immediate attention. In the end, everything really boils down to this one powerful idea. The goal isn't a certain type of birth. The goal is a healthy baby and a healthy mom. That is the definition of success. So as we wrap up, I want to leave you with this question. Was there a fact or a perspective today that changed how you think about a cesarean birth? Share your thoughts in the comments. Your journey and your story matter. Thanks so much for watching.